Hello everyone. Now today we'll talk about Marburg virus and what you should be aware of regarding the Marburg virus. In the middle of February, Equatorial Guinea in West Africa proclaimed a Marburg virus disease outbreak. According to the WHO, there have been at least 9 laboratory confirmed cases in this outbreak, 7 of which have been fatal, and 20 probable instances of fatalities. The first instance of the fatal illness has now been confirmed by Tanzanian authorities in East Africa. Health authorities are looking into 8 cases in total, and 5 of which are fatal, and have located 161 contacts who are being watched. Okay, I'm talking about February 2023. So, what is this Marburg virus disease? This Marburg virus belongs to the same virus family as the Ebola virus and is what causes the Marburg virus illness. Marburg affects both people and non-human primates, causing a serious hemorrhagic fever with effects on numerous organ system and it is potential for the profuse bleeding. The viral infection is a zoonotic disease, which means that it is contracted by people from animals. Fruit bats have been found as the host of Marburg virus in the prior outbreaks from which humans contract the virus. What are the symptoms and what makes this disease so dangerous? So, when in contact with an infected individual, the Marburg virus disease is both extremely deadly and highly contagious. And case fatality rates have been ranged from 24% to 88% in prior outbreaks, with an average fatality rate of roughly 50%. This implies that roughly 50% of those who acquire the illness will pass away as a result. Infected individuals frequently experience high fever, headaches, muscular aches, and malaise as their first symptoms. Additionally, typical symptoms include cramping, heavy watery diarrhea, and stomach discomfort. Similar to Ebola, this illness is a hemorrhagic fever in which those who contract it hemorrhage profusely. Patient may experience bleeding from the nostrils, gums, and eyes on the outside, and vomit, urine, stool may contain blood if internal bleeding is present. Shock and mortality can result from the serious blood loss. The incubation period, or we can say that the time between the infection and the onset of symptom, can last anywhere between 2 days and 2 days and 3 weeks. The majority of symptoms appear within a week, and mortality usually happens 8 to 9 days after the onset of symptoms. How is the Marburg virus spread? Marburg is transmitted directly from person to person, much like Ebola. This includes coming into contact with blood or other bodily fluids or items that have been contacted with an infected person's bodily fluids like bedding, clothing, needles, and other medical supplies. There have also been some instances where a man who has recovered from Marburg has transmitted the disease to his partner through his sperm. Person who come in contact with the infected person directly are those most at risk of contracting Marburg. That includes close relatives, caretakers, and healthcare professionals. Marburg virus infection should be suspected or verified before isolating a person. To avoid having direct bodily contact with the patient, those providing care should put on protective clothing such as gowns, gloves, and masks. Is there a vaccine, and how is Marburg virus disease treated? There is no vaccine produced to protect against the Marburg virus, but some experimental vaccine and other vaccine candidates are there in research. There is no particular antiviral medication available. Patients with infection are given symptomatic and supportive treatment, which entails giving them fluids, oxygen, blood transfusion as needed. Who should worry about the Marburg virus? Only Tanzania and Equatorial Guinea have so far been identified as having cases of the Marburg virus disease. There are action being taken to stop these occurrences. Containment efforts have been successful in the past. Marburg is not a recent illness. It was first identified in 1967 following concurrent epidemics in Germany and Serbia. Since then, a number of epidemics have been happened, most recently in Ghana in 2022 after outbreaks in Uganda, the Democratic Republic of Congo, and other places. There are ways to contain the Marburg virus even though it produces serious illness. People who spread it to others frequently exhibit symptoms. The Marburg virus is not an airborne infection either. Compared to COVID 19, which is more frequently spread by individuals who are not displaying symptoms, this makes it easier to control. COVID 19 is so contagious that it doesn't require direct contact and can be spread by microscopic aerosols. It is important to keep a careful eye on the two Marburg outbreaks in West and East Africa. The testing of a vaccine and treatment should be accelerated, and healthcare professionals in this area should be on high watch. Most of the world does not need to think about the threat of the Marburg infection right now. The Marburg virus, however, serve as yet another warning of the numerous zoonotic virus that can seriously harm human health. Thanks for listening, and beware about the Marburg virus.